In London's inner city, a psychiatric team is trying to treat patients in the community. Over the past 12 months, the team and patients have allowed unique access to the normally closed world of psychiatric care. This is Valerie's story.
I'm not mental, you know. I look simple, but I'm not stupid. A fool could make money, but it takes a wise man to spend it. Through life's weary road you go, 5 things observe with care, of whom you speak, to whom you speak, and when and where, how. I'm speaking, Shoshi.
What's been happening is that she's been throwing furniture out from her flat down to her neighbours.
I know.
She's been playing loud music at 4 o'clock in the morning, dancing in the street. So we got called down there. As I'm waiting for you to arrive...
We were coming.
You were coming. She walked out, and then I spoke to her, and she displayed to me the signs of being in immediate need of care and control, so we brought her back here.
After complaints from neighbours, the police have brought Valerie Smart into hospital. Now, psychiatrist Dr. Francis Raphael needs to assess her, along with the junior doctor Rob Bale and a social worker, to decide whether she believes Valerie needs to be compulsorily detained.
Thank you very much for your help.
Valerie, it's kind of standing up. It's a bit formal. Do you feel like coming out sitting down?
No, I'm not taking it sitting down.
Taking what sitting down?
What I've been through. If I was to rest, thank you. Hold up, please. If I were to rest, the phone would ring, my mum would phone and give me a silent call. I got fed up with it. I said, Chairman, British Telecoms ain't got to know, I'll just throw away the phone. So I threw out my phone. The only reason why I'm not sectioned, because I myself flooded the place, I was out of being sectioned.
You flooded the place?
I did it myself, I couldn't take any more.
You couldn't take any more of what?
My mum kept visiting me, because I even left, every time I played, there was, hold up, I'll drink some water. It's really serious, because since, I'm calming down.
Do you feel like sitting? You can't sit down now. Okay. You're talking very fast and very excited. And I know it's been a difficult day.
It's just a stress.
Difficult day, but
I was sleeping all day. Look, I've got my nightie on.
You haven't got dressed.
It's the stress of the policeman. I mean, come on, I'm not sick.
You feel like getting dressed today?
How do you mean I was dressed?
So why did you take your clothes off again?
I had a bath.
Ah, all right. You're kind of talking very quickly. Do you find that your mind's racing?
No, I talk fast anyway.
Do you? Because sometimes for me it's quite hard to keep up with you.
Oh, sorry. I'm very quick.
And sometimes also you kind of stop. And I wonder what happens to your thoughts then. Does your mind go blank or
No, keep thinking. I've got a photographic memory, could quote verbatim an oath of the Hippocrates. I swear by so and so to keep this oath and stipulation. I shall give no deadly medicine if ever required. I shall not give a pessary for a woman to
Okay, so you obviously got a very good memory. Why do you think...
I'm upset. Come on, but it's not a psychotic problem. Dr. Blonstein knows that.
No, I was just going to ask.
Well, I don't think you're very well at the moment. Obviously we need to speak, but I don't think you're very well at the moment. I think you need to stay in hospital.
But can I have my freedom, though? You may at least allow me that, to go.
I don't think so at the moment.
No, I'm not
you need to
accepting that.
Well, there are times when we can do that against your will, so I really think that would be best at the moment. I really think that would be best. Hopefully you won't be in hospital for long, but it depends on you taking medication and settling down.
Okay.
You all right?
Yeah. Okay, Valerie?
Thanks, Valerie. I'll see you again. Valerie Smart's hypermanic at the moment. I've not met her before, but she suffers from a manic depressive illness. And her behaviour today and probably over the last few weeks suggested that she's become high again. It sounds like she's not been well for a couple of weeks, perhaps since getting some compensation from a back injury. But particularly today, the police have been called out 3 times. She's been playing music loudly late at night, dancing in the streets. She's inappropriately dressed, talking loudly, shouting, speaking fast, and is quite deluded. She's not really dangerous to others except when she throws furniture out the windows. But I think she's more at risk for herself of suffering through self-neglect or just being inappropriate in the street. And she needs to be in hospital. So, section 3? Starts medication.
Under Section 3 of the Mental Health Act, Valerie Smart can be detained in hospital for up to 6 months if 2 doctors and a social worker agree it's necessary. The psychiatrist believes that Valerie is in need of immediate medical treatment to control her mania. The social worker's assessment has included reports of Valerie's behaviour over the last few days. She also feels there is no alternative to hospital admission.
Hello, Valerie. Can I just ask how you spell your name? Smart. Is it with 1 T or with 2? You're upset because we put the section on. I think it is very difficult, Valerie. I don't think you're well at the moment. I think you're a bit high, a bit manic at the moment, and I think it is hard to understand that when you're feeling good, some people think you're not very well. Okay? But you won't be in here that long, all right? She's quite... Can I just... Thanks. She's quite upset. I don't mind as long as we do it the same. She wouldn't answer. I think she looked really sad.
Yeah. It's their birthday tomorrow. And
Is it actually a birthday tomorrow?
it is, yeah.
This is Valerie's 26th admission to Springfield in the last 10 years. She was first admitted to a psychiatric hospital when she was just 7 years old. She was frightened to eat in case she choked and refused to sleep in case she never woke up again. Now it's down to the new junior doctor, Rob Bale, to build a working relationship with his latest patient.
Yeah. Do you want to come back through to the main bit of the ward?
I know my friends.
So how are you in yourself generally in the moment, Valerie?
You're stressing me, that's what I must say.
I'm stressing you?
Yeah.
How am I stressing you?
All shrinks stress me. I could do without a shrink, thank you very much.
Right. Why do we stress you so much, Valerie?
Always trying to think you know the more better. You see, very little is known about the human mind.
Do you think you need medication at the moment, Valerie?
No comment.
No comments, okay. And have you been...
For 38 years, people have been trying to tell me I'm mental. But they're wrong.
So is there anything you want to ask me, Valerie?
No, I know everything I need to know. I'm totally independent. I could do without you in the state, in the NHS, and from Virginia Bottomley, who tries to make people stay and take medication for life when they live and need it. I'm going to make sure all the medications come out. Every one of them. There's nothing wrong with it. All you need is love and tender care. Not those drugs that make them look like a zombie. Jesus Christ.
You seem to be very angry with the doctors here. Why is that?
They pressurize me too much. Don't give me any peace. See, when you're speaking to me, you're answering direct, but you're not pressurizing. And if you do that, I'll soon calm down. But the more they keep going, oh, you get more and more hyped up. And they say, oh, you're going high, you're going high. When it's all the same, they're putting pressure on you and just, you know.
Do you think you're going high?
No, never will, never have. I'm just a very quick thinking person. I don't know what it even means to go high anyway. Never took drugs before. Never even smoked before. Never even been kissed properly before. I'm still a virgin at 38. Never had a boyfriend. Men have tried to rape me, but they never get through to me.
Have you been in Springfield Hospital before?
All my life.
I don't have full knowledge of all of Valerie's background. As I said, the impression I get is that she's somebody who comes into hospital very unwell, settles with medication, and on discharge tends to stop her medication and have very limited contact with us, despite attempts to maintain her on medication.
Do you think that you're suffering from a mental illness?
No, definitely not. If I was suffering from what they said, those treatment they were giving me would have agreed with me and let me carry on. But instead it makes me want to kill myself, which is totally against the whole procedure. You know the song Kookaburra Sits on the Old Gum Tree? Do you know it? We used to sing it at school. Kookaburra sits on the yoga. And Mrs. Poikinen, my teacher, Mrs. S.C. Poikinen, said, when the year 2000 come, I'll be still as youthful as ever. Laugh, Kookaburra gay, your life must be.
Right, I'll just find Valerie. Seen Valerie? Valerie? Valerie?
I went to him because I had to clean up my place. It was in such a state and there were insects everywhere. I went to bed to lie in my bed and the police started banging and I said, oh, Valerie, let us in, let us in. Why? Why? What did I do? And they banged down my door.
So you're in hospital.
Yes.
Okay, and you're better than you were?
Yes.
Yes, okay. And you went home and you didn't tell anyone?
No.
It wasn't very helpful. We need
Why
to know
send
what
for
you're
police
doing.
to break down my door and my
Because
place
you-
is private? No.
You said you weren't going to shout at me.
Because I can't talk.
Right, Valerie.
Change the
Just talk-
subject.
Change the subject, okay. How are things on the ward?
Aggravation.
You get aggravated on the ward?
When they start to smoke.
Yeah.
And I'm left in the smoke and passive smoking kills. It killed Roy Castle.
Okay. So you don't like that, and your mood's a bit irritable.
Yeah.
Apart from that, any other worries on the ward? No. Okay. Right. Anything you want to ask me at the moment, Valerie?
Why are you keeping me here?
Why are you keeping me here? Well, because as we said on Friday, I think you were high. You think you were irritable and fed up. I think
Okay,
you
well,
were
let
high.
me go as soon as I'm well.
Right. When you're well, we want you to go home. You know
Okay,
that.
that's enough. That's enough. That's enough. If you say any more, you'll hurt me. Take my blood
Let's
now.
take your blood.
So I'm very sensitive. This is comfortable.
Well, sit properly so that your back is on the
this
back
is
of the... It is not
comfortable.
comfortable.
Valerie.
You're going to end on the floor.
Valerie,
I'm
stop
not
there.
going to end on the
Right.
floor.
Sit on the chair properly.
I'm not going to
Come on.
hold you. I've got a bad back and you're going to end on the floor.
Okay. You look the other way.
Valerie's blood needs monitoring, as she has reluctantly agreed to be given a combination of drugs, including lithium to stabilize her mood and major tranquilizers to get rid of her delusions and make her sleep.
Okay.
Don't I?
The aim of the treatment is to break her manic high as soon as possible, and then persuade her to continue taking drugs after her discharge in an effort to keep her stable and out of hospital.
Faster, please.
Yes, I'm getting it out.
Getting your cock out.
Valerie,
I can say what I want.
say what you want, but it's not very appropriate, is
It
it?
doesn't have to be appropriate. That's all you think about it over here. Sex, sex, sex.
Just take your
It's
finger
you
away.
the one that's uttering about.
Where's the hole gone?
I mean, clearly have to think about the birth certificate of our delusional.
At the weekly meeting, Dr. Rob Bale has to present Valerie Smart's case to Professor Tom Burns, the consultant psychiatrist who heads the mental health team.
First one we're going to talk about is Valerie Smart, who came in last Monday, at which stage she was elated, had pressure of speech, flight of ideas, was a bit irritable, and refused to stay in hospital.
And is there any suggestion of any medication that's helped her more than others?
She appears to have always settled on lithium and antipsychotics, but she always stops taking them.
And how's she been on the ward?
Pretty well, as you can hear her now. Really disruptive, very loud. Compliant with medication so far, but controllable, but extremely disruptive.
All right, come and seat.
Now, what are you trying to do to polarize my body? I'm not manic depressive.
You have pain in your hip?
Back.
It's your back. Oh, sorry.
Police kicked me.
Sorry? The police?
Police kicked me
Oh,
in
sorry
my
to hear
back
that.
and they can't I can't sleep. That's why I walk around at night.
Right. Tell me a bit about the sleep. How long have you had trouble with your sleep?
I don't have trouble with my sleep. If I choose not to sleep, I don't sleep. I just sleep during the day.
Right, but I thought you just said you haven't been able to sleep for some time.
I chose not to sleep.
And do you feel well on not sleeping, or is it a bit of a strain?
No strain whatsoever.
No strain at all. You feel good on it?
Yeah.
But in yourself, do you feel cheerful and happy with the way life is?
I always
apart from the
feel
aggravation?
happy. I always feel cheerful. I always look on the bright side of things.
Oh, good. Are you eating all right?
Mm-hmm.
And you're feeling, on the whole, quite cheerful, but a bit fed up with the aggravation. Is that right? Have I got that right? Yeah. Have you felt that people have got at you in here? People been unkind to you, or?
I know you've been unkind to me. Not that I thought. I know.
You mean because they put you on section?
Yes.
Yeah. And you've been having an injection?
Capixul. Capixul is for acute psychosis. I have not got acute psychosis. I've got acute face.
Acute? Acute face. Sorry, I was a bit slow.
Just a bit.
Yeah. I was thinking too hard. How long have you been on the Capixul, Mary?
For years.
Years and years. Does that help?
No.
No.
Makes me put on weight, and I've got a fracture of the hip and a bad back.
Can you think of anything that we've done for you that's helped?
No.
Right. Well,
They've tried everything.
Well, let us try.
Try nothing.
Oh no, I think it's better for us to.
Well, just keep me on that for now, but don't increase it. I'll take it for now.
Well, I'm inclined to increase it a little bit, but so that you can get home quicker. My experience.
No, you don't get home quicker increasing medication. I told you it doesn't agree with me. Full stop, period.
Well, we can give it a trial if it doesn't.
No, I don't want it to gamble with my body anymore.
Well, we wouldn't be trying anything that was dangerous or.
LIE true. What do you know about LIE true?
Lie, do you mean?
Propaganda.
Okay.
I'm going to write Mr. Major again.
Well, I'll suggest to Dr. Bowes he can talk with you later if you want to think about it. Okay?
I don't want to think about anything.
Nice to meet you.
afterwards,
Okay. Good to meet you, and I hope things sort out soon.
You didn't even touch my hand. Good to meet you. LIE true. You English people too lied. That's all I have to say. I haven't got time to waste my breath.
I'll see you later, Valerie, all right.
Leave my body alone. I will get married. I have a right to sexual satisfaction. And by the way, I'm 38 and still a virgin. My hymen is very intact. Thank you very much.
What's the
Bye.
Bye. What's the diagnosis? Yes, it's called manic depressive psychosis, and she's got what's called a hypomanic episode, isn't it? That's what you're taught to say nowadays. Although I think increasingly patients don't like to have it referred to as manic depressive disorder because, you know, maniac is used by all sort of tabloid press to say awful things about people, and a lot of patients prefer this to be called a bipolar affective disorder. So although she's actually got no evidence of depression, has she?
Not at the moment. I think she has had depressive episodes.
But I think she's got suffering from hypomania. Why don't you give us a night sedation as well to help get her off to sleep and if people have a bit of a rest? And if we got her something that would sedate her a bit, then I think she'd calm down a bit.
Professor Burns has decided to increase the drugs in an effort to control her mania. Valerie, however, still doesn't believe that she needs to calm down and has decided to go to a hospital tribunal to appeal for her immediate discharge from hospital. The problem is, she'll have to wait 6 weeks for the appeal to be heard.
One thing I want you to do, especially for me, and it's something everybody needs. Each night before you go to bed, my baby, whisper a little prayer for me, my baby, and tell the good Lord.
Valerie has remained somewhat elated. As I think we said on Monday, she's still quite high, not settling particularly. I've seen Valerie this morning, and she remains fairly certain that she's not ill herself, as she's always been when you've seen her. but she's actually agreed to take some extra medication to calm her down today. So we've just given her an injection of a neuroleptic drug.
Clopixel, a major tranquilizer, has been given to Valerie in an increased dose.
Doctor injected me with Clopixel, the color, so she did that. I start to dribble. I can't hold a pen properly. And my right handwriting is usually quite good. I fall about more. I feel useless. I want to kill myself. I didn't feel like this before.
The medication as such is not going to cause you to want to kill yourself. It may make her feel stiff and sluggish, which are unpleasant, and therefore she's interpreting those as feeling depressed or down. What have you got here, Valerie?
Sherbet to cheer me up.
Sherbet to cheer you up. It's probably going to make you feel sick, isn't it, eating all of this?
I had a good bowel motion just now. I feel
Oh,
alright.
I'm glad about it.
Although drugs are very effective at breaking highs, there are side effects: stiffness, slurring and dribbling.
So what's been happening, Valerie? How are you today, anyway?
Just want back my hand. Don't stop taking away my body from me, in so to speak. Because every time you inject me, every time you give me an injection or a tablet, you're taking away a little piece of me. I can't give any more of my soul away and still watch myself in the mirror every day.
Do you not think that we're giving you the medication to help you be you?
No, it's not
you being
me.
unwell?
That's not me. Look at my face. That's not me.
Well, I agree it can affect your skin a bit.
I'm not talking about my skin, I'm talking about my expression. I look like a nutter.
Valerie, why are you doing this now?
Because I'm annoyed.
Why are you suddenly getting annoyed with me?
I was annoyed from the start.
Well, you were laughing and joking with me
So
just now.
anybody can laugh and joke. You don't have to be sincere.
Why have you got so irritable, though?
Because I want back my hair, my lovely complexion. Because I'll never get married if I don't. Everybody's got cars, everybody's got this, I've got mobile phone now, taken away from me. But it's in care anyway, so I don't
It's
mind.
safekeeping, isn't it?
I just want to go up in the work. I'm behind. I am behind.
Well, but Valerie, that comes to things that we talked about before, isn't it? Because in our view, you are unwell and you have been unwell before. We actually want to keep helping you. Because we realise...
With what?
Well, by helping you look at the things that you want to do with your time.
I know what I want to do with my time. I don't need anybody to tell me what I want to do.
No, I didn't say to tell you, Valerie. To help you achieve the things that you want to achieve.
I can achieve the things I want to achieve if I want to. I'll tell you something. I'm going back to physics, CSC physics.
But hang on, Valerie. I'm not saying you can't achieve things. Did I say that?
You did in a nutshell.
Well, I didn't mean to, Valerie.
Okay.
What I'm trying to say is that it can be difficult because of all the things that have happened in the past.
Yeah.
And sometimes people benefit from having some help.
Okay.
You know, we don't just give medication.
Okay. What I'd like to say is I've got my RSA in typing.
Good.
I passed the arts test at the age of 8. I got my word processing with distinction. I also own a parcel, a word parcel.
Good. Well, when you're better,
Yeah, that's
we
not
can
too
talk more
long.
about what you're going to be doing, can't we?
Yeah.
You can tell me what your plans are.
Okay. Still don't agree with everything comment, but for two men to shake hands, you got to be in agreement with something.
That's right. Okay, Valerie, let's leave it there, and I'll see you on Monday, all right?
Okie doke. I'm tired.
Well, go and have a rest.
Thank you, Doctor.
Valerie, you got crisps.
Even though we disagree, we'll have to liaise on something.
Well, we will. You got crisps all over your bed again, Valerie.
Oh, dear.
I'll see you on Monday, all
See
right?
you then, Doctor.
Bye.
Bain. See the card I got for you? Please help me, I'm falling in love with you. Close the door to temptation. Don't let me walk in. All my worldly possessions I give unto you. Please help me, I'm falling in love. I'm tired with you. Tired. Tuck me into bed.
Valerie?
Valerie is has perfect timing. That was Valerie. Dave. Well, I think seeing her today, I think she's better. She's a bit slowed down. Physically, she's dribbling a bit, although she's not complaining of any side effects. Sleeping too much, but not too much in my book. She's just, I think the medication's taking hold.
Mm-hmm. I'm sorry for the slight outburst just now. That was me.
That's all right, Valerie.
Charles trying to get his hands all over me. That's one thing I don't tolerate. That's why I'm still a virgin today. I don't know his name. Trying to get his hands all over me.
I'm sorry to hear that. How are you?
I'm all right, thank you.
Good. Do you feel any different to when we met last week?
Yeah,
In what
much
way?
more relaxed.
More relaxed?
Yeah.
You look more relaxed.
Yeah.
You sleeping well, Helen?
Oh, I sleep all the time, Doctor.
During the daytime as well as night?
And during the night.
Good. What do you think, you know, this time that you've come into hospital, what do you think's been the problem? You think you've been high?
No, I didn't think I was high.
Because we thought you have been.
You thought I had me, but I didn't think I was. Not particularly.
Okay.
Perhaps a little bit.
Let me ask you, if I suggest to you today that you were high, what would your response be to that?
Oh, because it's my birthday.
But
you
do you
feel
think,
elated.
Do you think I might be right that you were?
You might be right.
Yeah. And it might be that you need to take sort of precautions to
stop getting too high.
Again, yeah.
What's wrong with being high anyway?
Well, a lot's wrong with it if it goes too high. People can.
I don't take my clothes off. I don't fall into bed with men.
No, but you do things that, to be honest, Valerie, you'd regret when you have time to think about it.
Okay.
So I think it's worth trying to avoid it if you can. Good. Thanks for coming
Wasn't
in, Valerie.
that bad, was I?
You were very good. I think things are shaping up.
Are you happy for Valerie perhaps to visit home and try and sort of things out?
Yep.
Now that her manic high is being successfully controlled by the drugs, Valerie is to be allowed to visit her home to prepare it for her eventual discharge.
No. This is new heaven, I call it, paradise. Welcome through the hallway. Come through. You may enter. This is called New Bethlehem because that's where I get my sweetest sleep. And this bear, he's called Cuddles. He's got a rattle. I bought this in Arden and Hobbs to complement my, you know. I also got this from the social services, this wardrobe, and I did some handiwork of myself on it there to hide the rust. This I bought because I thought I was in love with Ryan O'Neill one time. It plays Love Story. This is Karen because it reminds me of Karen Carpenter. It plays this. Close to You by Karen Carpenter. That's why I named this doll Karen. This photograph was taken on the 20th of September 1989 when I was 33 on my birthday. I sent this very picture to Lady Diana and she sent it back because I wanted to get in contact with Prince Edward. But she said she wasn't allowed to do it that way. So she said Princess Diana's actually seen this photograph. Sorry the place is a bit of a mess, but I try. I'm clearing. I'm a housewoman. I work all day. Soon be back to normal. Right, work.
Valerie's mood disorder is of a severe nature, and although drugs help to control her symptoms, she has always stopped taking them when she is discharged from hospital. Valerie lives alone and doesn't have a partner or a job. It may be easier to be ill than to face up to the reality of daily life. Although she's allowed out on home visits, Valerie remains a compulsory patient at the hospital under the original section order. She has now been a patient for 8 weeks, and it's time for her appeal against the section to be heard.
Got some water for you here if you need it.
At the Hospital Manager Review Board, 3 lay volunteers appointed by the Health Authority will judge Valerie's case. The mental health team argue that for her own safety, she should stay under their control.
Bipolar affective disorder is effectively a lifelong disorder where someone may be very well for long stretches of time, but the disorder is lurking in the background, and Valerie needs to think about protecting herself, both with medication and also with support and contact with the psychiatric team.
She has improved from the condition she was in when she was admitted.
Absolutely, yeah. Big improvement, massive improvement. Yeah.
And you think she's not ready for discharge yet?
Not right away, no. Like I said, because it'll probably precipitate another relapse.
Do you think that you've been ill when you've come into hospital?
I do agree that I'm over-enthusiastic, but what's wrong with that as long as you don't take your clothes off? Perhaps I was stressed, but I never go low, I never depressed. Perhaps in my terms, I didn't think I was that ill, just very stressed out and overexcitable.
Anything else which you want to tell the managers that I haven't asked about?
Do you want to know the honest truth? This hospital can't give it to me. I just want a sexual relationship with somebody that I love. Just if it's somebody to start holding hands, just to go places. I've never even seen Joseph Amazing Colour Drinker. I just need a boyfriend.
She doesn't seem to have insight. She needs attention. She needs looking after.
But can she receive that care at home?
From the past record, I can quite clearly see that she can cause danger to herself by attention-grabbing activities which she is indulging in.
She's lived for 38 years, and there haven't been an indication that she's vulnerable to the extent that somebody may do harm to her as a result of her behavior. My inclination is that we really need to consider whether she's gone as far as she can go, as far as treatment is concerned here, and therefore she should be released.
You see, supposing we discharge her from section, she may stay in a while. Ultimately, she will either discharge herself or in the natural course of events she will be discharged. She may be slightly better when she's discharged than she is now, but she will not have tremendous insight into the condition. And if she continues the contact and the depot, she may keep on for quite a while. But sooner or later, in this type of condition, something's going to upset her and she's going to come back in. Will our discharging her from section today significantly improve her chances? I don't know. But she's a person with rights as a person, and I can't see a great deal of reason for keeping her on section myself. So we are going to release you from section, and we hope you're going to do as you've said you'd do. We would advise that you continue as an informal patient, and that you continue to take the medication as prescribed, and that the contacts with the community worker and the hospital be continued. And we hope that all goes well now in your flat, and that you continue to make good progress. Thank you very much.
Delighted by her victory and ignoring the tribunal advice, Valerie has decided not to stay on in hospital as an informal patient. She's returning straight home to live in her flat. Five days later, the story began again. It was Valerie's 27th admission to Springfield. She had been arrested once more by the police.
I'm going to New Zealand.
Do you want to come in? We can then
Not
we can
with
talk about
you. I asked you what was it like when you had your first bronch, and you were so rude to me, and I've never had a bronch yet.
Okay.
I had to express myself, pull down my knickers and my bra.
There's a lot of people here.
You're just trying to shade the conversation because you're embarrassed, because your first time wasn't good.
I don't mind talking. I'd like to talk to you, but it's
Okay.
there's lots of people here. Let's come in. Okay, I'll just turn the light on if I can find it.
I was so sexually tensed up yesterday. I had to express myself in a BT phone. I didn't know what to do.
You don't know what to do. You don't look in a good state, Valerie.
Why don't you leave me alone in my flat?
Because you don't look very happy, that's why. And you
Because no one pays any attention to me. You didn't even touch my hand, you didn't touch my hand and seen the scratches. Look, I've got a scratch there.
But Valerie, see, we very much wanted you to stay in hospital. We wanted to give you that attention, but
You didn't give me the attention. You did not give me the attention.
Valerie,
I don't want to stay. I just want to go home.
No, Valerie,
I just want to go home. I don't like you.
But you're going to have to stay in
I
hospital.
don't like. Just give me peace to then.
It was time to begin the whole section proceedings again.
Kookaburra gay your life must be.